A key vaccine panel is meeting today for the first time since HHS Secretary RFK Jr. replaced all its members. The CDC Vaccine Advisory Committee is discussing fall vaccine recommendations in Atlanta, but that's not stopping former and current CDC staffers from protesting this new panel. They're actually planning to carry out a parade of preventable diseases. That's right, carrying signs, even costumes, depicting vaccine preventable diseases like the measles, smallpox, and COVID. Happening at the same time, President Trump's nominee to lead the CDC. She's on Capitol Hill for a Senate confirmation hearing. We're tracking that as well. Joining me now, coordinating producer for our medical unit, Sunny Salzman, also our medical correspondent, Dr. Darian Sutton. I guess, first of all, Sunny, sounds like quite a creative way to protest the vaccine meeting today.
It certainly is a creative way to protest the vaccine. As you said, these former and current CDC, current and former CDC officials are going to be dressing up as viruses, and the whole intention here is to show that many of these diseases are now vaccine preventable. And the subtext here, the reason for this protest, is because the current health secretary, RFK Jr., has handpicked 8 new members of a crucial CDC advisory board. And there's concern here that many of these members are expressing vaccine skeptical views.
So, Dr. Sutton, what's your take on what we're hearing from this panel today? And are you concerned that this panel has been completely replaced by RFK Jr. picks?
Yeah, absolutely concerned, Kira. You know, my concern is shared by many physicians, pediatricians, emergency physicians, and other providers who talk to me about their fear of the prospects of the future. When we talk about that parade of preventable infections, it's not difficult to see the real-time consequences. Right now, we are on the brink of achieving the highest number of cases of measles that we've seen since 1992. And that's secondary to a decreased participation rate of children getting vaccinated in this country, as there is an estimated 280,000 children in kindergarten that are not up to date on their vaccines. And what we're hearing from this panel of experts that have been chosen by RFK are questions that continue to poke at that public confidence. And unfortunately, that is really important in terms of the outcomes of getting parents to participate in these vaccinations. It's important to understand that vaccines are arguably the most tested medical intervention that exists, and they continue to be. But with additional questions that resurface those old fears, that's what draws on that decreased confidence. And unfortunately, that is more likely to lead parents away from evidence and data rather than talking to providers about what is clearly understood. You know, there's a lot of confusion right now, but if you cut through that noise, the evidence still remains clear that these vaccines are highly tested, they're highly effective, and they're safe.
Well, one more, Doc, if you don't mind, amid all this confusion, how can parents best, find out what vaccines their kids actually need? Sometimes it's hard to weed through, what's necessary, not necessary, what's safe, what's not safe.
My advice to parents is that if you're asking a question about your health or the health of someone that you love, make sure that you're asking it to the provider that has the experience, the expertise to be able to answer that question. Think about it if you were sick. Would you go to a friend and ask them about how to treat your cold or flu? You might, but you would probably trust in the opinion of the provider, the physician who's treated your health. I would encourage parents to do the very same thing when making decisions about vaccines. The American Academy of Pediatrics stands with the work that they've been doing with ACIP that has been going on for the past 50 years that has saved and prevented countless illnesses, diseases, disability, and death. So making sure that when you're asking these questions, you're asking them to the right person who has been verified, certified, educated, and trained to be able to answer those questions confidently and appropriately.
Dr. Darian Sutton, Sunny Salzman, thank you both so much.